Hi, Dr. Laura Dabney here with you this month talking about addictive behaviors. And we're broadening the definition this month to talk about uncontrollable behaviors, seemingly uncontrollable behaviors. And today I want to talk to you about sexless marriages and addictive behaviors. So again, we're talking about behavior in which we feel we've told ourselves we're going to stop doing, or we're told ourselves we are going to start doing, and we're unable to do it. And it can be so puzzling and so overwhelming because we're adults and we should be able to do what we want to do. So these can be sort of kicked to the side, but when that happens, they tend to build and blow and come up into a really bigger problem. So with a sexless marriage, that's a very common reason for addictive behaviors or uncontrollable behaviors that I see in my office a lot. And in sexless marriage, what typically happens is people use this as an excuse to then justify or explain their behavior. And I'm using some case examples this month to help you understand this a little bit better. And in this example, I wanted to tell you about a woman who came to me. She was hopeless. So her husband was working excessively, and so their sex life was on the back burner, barely existent, and she felt completely tossed aside. She felt hopeless because she had talked to him till she was blue in the face, according to her, over and over and over again about this problem, and he did not change. He just would say, oh yes, he'd make some promises and not deliver. So hopelessness was the only thing she could do, and to deal with that hopelessness, she had to eat. Eating was the only way she could keep afloat, to take care of their children, and she had no choice. So we had to talk a little bit about that. And it turns out, very interestingly, that this hopelessness had started as a child when her mother had the same problem with her father. So her father, when she was little, would come home late and would not call. So dinner time would come and her mother would get more and more worked up and leave them, she'd be all wrapped up in her head about some rage at the father, throw the food down, she and her brother would eat. And when the father did eventually come home, there'd be a huge argument. And this happened weekly or every other week on average. The patient, as a child, would take the food, leftover food, the food that was left on the table because everybody was arguing, into her room and eat it and hide the dishes and the remains all over the room. Well, then she'd try to get up early enough to get it to the kitchen and clean it up. So it was this great deal of effort and work that was going on with the patient at the time. But the mother would find out and scold her, and this became a thing between them. The mother actually, even to the day that she came in to see me, was still interfering in this person's weight and eating habits. So she really felt that that was the only source of comfort, and was not, so when I asked her why she wouldn't talk to her husband about it to get comfort, we're back to, there's nothing I can say, I've said it all, there's nothing left. What she wasn't comfortable with, so the lie was that there was no other choice. What she was covering up was this tremendous fear of being able to, well, first a shame over her overeating, and then secondly, this tremendous fear about using her constructive aggression. While she had talked to her husband a lot, she never raised the stakes. She never used a little bit more aggression to get him to see how important this was to her. It's our responsibility to advocate for ourselves. We make the mistake of thinking, well, we said it once, he should then advocate for us, or she should then pick up on it and take the ball and run with it. No, this was her problem, and we had to help her understand that advocating for herself did not mean she was going to destroy the relationship. Now, so she had to use a little bit stronger language, like, this is serious. When you make a promise and you do not fulfill it, you're hurting the trust between us, and it's destroying our relationship. So we got to use a little bit stronger words. He paid a little bit more attention. In this case, she actually did end up going to a divorce attorney to just understand her options. That was the final constructive aggression move that got him to wake up and start following through on some compromises with her, which they did. And that helped her a great deal. And we also helped her with the rage at her parents, which she was hiding. So that all dealt with, and the marriage getting a little bit closer, they were able to regain a sex life and their marriage, and they lived happily ever after. No, they did well when they left here. They were doing well. So again, there's no hopelessness. That's not an option. Often that's the lie we're telling ourselves, an excuse to continue the behavior. So if you're having trouble with an addictive behavior, need some help with that, please give us a call, 757-340-8800.